Hello everyone. Welcome back to Learnings on 24 in the 7. So here, myself Deepa, your trainer. So in this session, we are going to talk about communication skills in healthcare. So do you think it is very important to know about the communication skills? Yes, of course, because communication is a major part where we are collecting information, we are giving information, we are just understanding the information, and we are carrying out things. So, in a healthcare setup where we all are working, it is very, very, very mandatory and very, very important to be a good communicator. No? So, in this session, we are going to talk about what is a good communication, how to become a good communicator, and how to use certain techniques or tools to give or take a proper communication. So, we all are in the healthcare settings. We know when we are considering the major errors or events or something, or the patient is become not satisfactory. So, all behind all these stories, something related to miscommunication or wrong communication or an improper communication will be there for sure. So that shows the importance of communication skills. So let us see the screen and go to the PowerPoint. So hope you can see my screen here. So here, communication skills in healthcare. So see here, you can see so many people are sitting or standing by thinking or with a laptop, with a thing in their own circle. No, so when we are on our own circle, we are not communicating, we are not connected. We are disconnected totally from the group or from the team. So when we start the proper communication, we are developing our team as well as we are giving or we are taking a proper communication for the patient safety. So you all know IPSG2, which is International Patient Safety Goals. Second goal says improve effective communication. So it is very, 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 very important as we talk from the beginning onwards. So see, communication, how it starts. Usually we all are telling it starts when somebody is telling something, but it's not like that exactly. No, see, when we are listening something, somebody is saying something, and when we are listening something, and after listening, what we need to do, we need to understand. So after listening, we will understand it, we will process it in our brain so that we are decoding the information, and now we will respond. So after a proper listening and understanding, if we are listening or responding, it will be proper communication. So see, two people are communicating. So a good communication. What is a good communication? We all are communicating. So some communication simply means I am telling something to you and you are getting that information and you carrying it out properly. You should be able to understand what I'm telling or what I'm instructing or what the other person is communicating or conversating. So that is simply communication. So there will be the process, and their process we learn throughout our training periods, and I'm not going to repeat all these stuffs because it start like messenger, sender, message, environment, medium, all these things. I mean, that's not at all we need to be used in the practical scenario. So I'm just telling you certain tips that you can use in your daily practical life. So good communication, there is a tool that is SAFe. Okay, so first we need to set the things. For example, just you imagine you are going to transfer a patient from your unit to some other unit. Okay, so you are going with the patient, so you need to set the communication. What communication you need to give to that particular nurse to whom you are handing over your patient. Okay, and how you need to proceed with. So first of all, you should have a proper idea with you. Now, you will elicit the information. You may be going to the case file or patient file. You'll see that what are the investigations the patient underwent, or why we are shifting the patient to the particular unit, or what is the progress treatment which we supposed to give to the patient. Like so many things we will elicit it. That information we will elicit. And now we said the thing. Now we've elicited all the information which we want to give. So the next step is giving information, which is a major step in the communication process. Now, understand. That is a Persian perspective. And finally, we will end the communication. So that is SAFe tool. Okay. So that is just a skeleton for a proper communication. See, now already in the beginning we told that the communication, like, it is not a proper thing. Why? Because there are so many barriers. No, like, see, you can see a wall in between the people so that they cannot hear. So yes, there are so many barriers, like we are not giving, if we don't have the proper idea, that's a problem. No, that will hindrance, or that will affect the communication negatively. The communication which we are giving will not be proper if we don't have the proper idea. That's one thing. There are so many things which you can tell, like language barrier, and what else, then understanding problems, like, not enough loud, not properly documented. So many barriers are there. No, so we are, rather than talking about the barriers, we are going to talk about how to elicit these barriers to give a proper communication. Okay, so now we're going to just go through effective techniques of communication. So how can we give a proper communication? See, there are certain techniques. When we are like, we all are under, I means when we are student or something, multiple times we'll give excuses, no? Like, if I didn't submit the care plan or the case study, or I just reached late for the attendance to the college. So we will have hundreds of excuses, like traffic jam, no? And was having headache yesterday night. So many things we used to tell to our teachers. I'm just telling this for an example. So disarming, one technique, sometimes the teachers, we are still remembering or loving those kind of teachers might use this kind of techniques, no? So disarming, see, find some truth in what the other person is saying. For example, I am a student and I'm coming and telling my teacher, today morning, something was there in the road or something, and I couldn't reach on time. So my teacher totally understand that I'm lying. Okay, because she knows that I'm staying very near to the college, and I am walking and coming to the college. And one day suddenly I'm telling her that, thinking that she don't know that I'm a day scholar, and I'm telling her that I couldn't get the vehicle, or some traffic jam is there in the road or something. So she knows that completely I am wrong. Still, she is feeling like she's trying to understand me, and disarming sounds like, yeah, you are right, I can often make mistake, like that kind of a sound, no? So that is disarming. Got it? Because that I know that you are totally wrong, but still I'm trying to just tell you, yeah, you might be right, I can be wrong, no? That kind of an acceptance. So when somebody is telling like that, we will feel that guilty feeling. So that's a kind of technique where we can give a proper bonding or proper communication, and where we can build up and move to further communication. Second thing is very common, which we all know, all the healthcare professionals know, which is empathy. Always we used to tell that we need to be empathetic to our patient, no? Not sympathy, empathetic. We should put ourselves in their situations or scenario. So that is empathy. So empathy means putting yourself in other person's shoe and try to see the world through their eyes. So we are just being themselves and we are trying to understand their problems. Fine. So empathy sounds like, you seem very hurt and frustrated with me, or I want to get this straight. Are you angry with the way I spoke to you? Like that, we are in their position and we are just trying to think. I mean, nothing. We are just trying to understand. We just being in their position, and then there will be no issues. Like, if everybody is trying to understand others, there will be no issues, there will be no problem, world is ultimately fine. So that is another important and effective technique for a good communication. Now see, inquiry is inquiry only. So sometimes we used to, like, very like casually or roughly, we used to ask certain questions, especially for example, we used to take this one history collection during our student period, no? So we used to ask, what's your name? Like, it's our right to ask anything to the patient as they're admitted in their hospital, like that we are dealing the patients or something, no? So like, what happened to you, what's your family, like roughly. Yes, we can inquire the questions, but just politely, or having a technique. Can you please tell me your thing, or can you please? So certain magical words are there, we all know that. Please, good, thank you, which Indians rarely use, no? We used to tell like that only. Then another thing is, I feel, I understand statement. Most of the time we used to tell like, you, no? So instead of that, I feel, yes, I feel like that. So that person can understand what I'm telling, no? Or I understand, or I can understand your situation. So, or I feel that you're upset. No, I understand that you are going through a tough time. So that person will be more open and they will be thinking that we are understanding them more. No? And the last technique which I want to tell you is stroking. Stroking is some kind of disarming technique only. Find something genuinely positive to say to other person. This indicates that you respect them even though you may angry with them. Okay. So stroking sound like, I really appreciate how much you care about your patients. If just imagine I am a nursing head or your ward in charge or something, and I know you that you are totally not at all bothered about your patient and you are a very casual staff. Okay. But still, I'm trying that, I'm telling that, and every day I'm getting angry with you, you will just feel like, oh, it's her casual behavior. She will get angry, whatever I'm telling. That never works. No. So instead of that, if I'm telling that, I really appreciate you are working a lot, but still you can improve. Those kind of statement people will accept. So that is the effective technique. So certain effective techniques I just suggest for you. Just practice it in your communication of daily basis communication and see the improvement. Sorry. So see, none of us are born as a good communicator. No, communication, it's a skill. None of the skill will develop without practice. There is a single mantra for developing the skills, whatever it is. It is our technical skills, professional skills, and even including the communication skills. So only one mantra will be working, practice it properly. So practice only makes everything perfect. So you can practice all these techniques. See, no one is a born communicator. So practice how? With your family, with your friends, with your colleagues, with your patients, to whomever it is possible to conduct with. And practice them with difficult and easy situations. Okay. Practice them one at a time or simultaneously. See, another important thing which matters during communication is body language. If I'm teaching you like this, see, I want everything on right time, like this, like this. See, my eyebrows are up. So it shows that I'm not interested or I'm irritated or something. I just want to complete it and I want to run away. You know? So this is the thing, body language matters. No? Or I'm simply sitting like this and saying, see, today I'm going to teach about body language. So it gives a bad impression, or you will, if the teacher is bored or something, you will be definitely will not listen to that particular thing. No, so body language really, really matters. You can see certain images. See, somebody is either, so by observing a person with gestures, without even opening the mouth and saying a single word, we can understand the thing. That is the power of body language. No, so he is sitting like this. Either he is praying or he is worried, that we can understand. Second one, see, talking, yawning in between. So he is not at all interested in this particular matter. And the other one is angry, irritated. See, and the other one is, oh my God, today also this mom is teaching and she's killing like same things. I don't know, this kind of frustrated. And the last one, peeping up. Peeping up means we all did during, again I'm remembering the college days when the teachers is coming for the inspection, or in the, on the floor, we are just inside the patient room and we are peeping up whether she went or not. Otherwise she will ask whether you did the history collection, physical examination, what is the finding, that this no. So just to escape like this, that body language indicates attendant is coming, attendant is a violent attendant, so I just want to hide myself, that kind of attitude. See, positive language, body language, rarely cost time. It doesn't take any time. It's an automatically during our communication or during any of other thing, what we are doing, any other thing, automatically it comes. So in fact, it's a time saver and makes for happier, more relaxed patient. This intent makes for happier and more relaxed nurses. No, so if we have a therapeutic relationship, if we have a good bonding, both of us will be satisfied. As me as a nurse and my patient as a customer, both will be happy. No, now see a very good example of therapeutic relationship. Touch is a very sensitive thing. No, so touch also having the positive touch and negative touch. So we all know what it is. No, so how to touch a patient, how to console a patient. Really, this picture will tell us how effective the touch in your therapeutic relationship is. See, another one, eye-to-eye contact. Here you can see the eye-to-eye contact, which matters very much. Eye-to-eye contact. See, this is a very bad manner. Nurse is over phone and she is showing some gestures which she is not in this world. Aggressive behavior. Okay, and daydreaming. And see, pointing is not at all a good habit. See, we used to tell like that when we are pointing to somebody, the remaining for 3 fingers is pointing towards us. No, so never point somebody. If you want to point or show something, you can show like this, gesture like this. No, so another one, they're also having the group communication, they're having, and they're having a good eye contact. So these are the certain good body languages or bad body languages which you can show and cannot show. Now, certain things which don't say. Okay, as a healthcare worker or healthcare professional, most of the time, or sometimes, or maybe rarely, we used to say like, I don't know, which is not a good thing. No, instead of that, you can tell, I will find out, or I can find out it for you. Just give me 2 minutes, or just give me a second. Like that, you can communicate. How much difference it can create. No, second thing, no, if somebody is telling you, please give me something, or please do this for me. No. So don't say that. Just tell them what I can do is this thing only. And for further thing, I have to ask or see somebody for your help. Like that, you can communicate. Don't say that's not my job. No, many a time we used to say that it's not my job. Okay, so never say like that. It is not my job. You can say this is who can help you. For example, bedsheet change, patient one day bedsheet change. So usually housekeeping staff maybe, or GDA might be doing it in based on your hospital. So you are telling, this is not my job. You can call the housekeeping. This is not the right way to do. You can tell them, I will show you the person who can help you, or I'll send the person, or I'll bring the person. Okay, so that's what your sound should indicate. Now, don't say, you are right, this is really bad. They are telling something about your doctor or a housekeeping person. Yeah, you are very right. That housekeeping staff is not at all good. Never say like this. That is your team member, healthcare team member. So you can tell them, for them, I'm sorry, I can understand your frustration, but you can explain the thing then. Okay, then don't say, this is not my fault, I will not accept any fault. Never say like this. What you can say, let's see what we can do about this. No, we can find a solution. Don't say calm down. Okay, never say calm down. This is not like this, not like this, calm down. So say, I'm so sorry. What will lose? We are saying a sorry. We are also happy, they are also happy. No, don't say I'm busy right now. So what they need to do, we are supposed to take care of them. So instead of them, you can tell them, I'll be with you just in a moment. Give me just a moment. I'm with somebody else or something. Just give me a moment. I will be with you. Don't say, call me back. She's very busy. Call her back. We used to tell, in the telephonic communication. Otherwise, I'm very busy right now. You can call me later on. You just tell them that I'll call you back. What's the problem? They'll be happy, and you just give a call to them. Everybody is busy as in their way. No? So another certain things that we used to say, yeah, really, we are really short-staffed. No, almost all the hospitals in the country and even outside the country are short-staffed in the current scenario. So, but never say this to your patient. See what your patient want to do upon this, because see, you are short-staffed. It is not the patient's mistake. They are paying, they are coming, they want the service. It's their right. No, so never tell this to them. You can tell this to your management. We need more staff, not to the patient or the attendant. I have never done this before. Going for a cannulation, hands are shivering like this. Ma'am, I didn't do this. Never in my life. Don't say like that. Okay. You are a trained professional in front of them. Don't show your frustrations and all. If you are not confident, you can seek the help from others. Don't go and tell in front of them, I never did this before. My charge nurse sent me forcefully to do this. Okay. Another thing, I don't know what the doctor write. We should know. No, I'm not sure that why you are in this medication. You have to know. Nowadays, patients are much more informative about their medicines and all. No, they don't treat nurses well here. This management, no, they never treat the nurses well here. No increments, no promotions, nothing. We are just frustrated here. What the patient will do with that? Okay, so never give wrong communication, or which you are not supposed to tell to the patient. Talk these things to the right person who can correct it or who can give some solution to you. Patient cannot do anything upon this. No, So these certain things we should be very, very careful while we are communicating. So hope you're clear, or you are here with me up to here. Now I'm going to teach you or tell you about certain communication tools through which we can make a better communication with our customers or even with our healthcare team members. So the tools are edit, isbat, call out, check back, read back, and blast. Okay, so we are just going through these communication tools and how to use it effectively, and we will be saying for today. So the first tool is edit. Okay, see, you can see in the side that is edit. So what is edit, or when we are supposed to use this edit? So A means acknowledge the customer or acknowledge the person to whom you are communicating. So basically, edit tool is the tool which we can use in between the healthcare team member and the customer. Means nurse or patient, or doctor or patient, or doctor or attendant, nurse or attendant, or the lab technician, any customer, any healthcare team member to the customer or the attendant. I mean, customer in the sense patient or attendant. Fine. So A means acknowledge. See, acknowledge them. Hello, sir. Good morning. How are you? Make your presence. Okay. Then move to I. I means introduce and identify. I just wrote introduce here, but you can add identify also. So just imagine I'm going to a patient side for a medication or even for an hourly rounding. Okay. So I'm just going to the patient side and acknowledging, hello, sir. How are you? How are you feeling now? Good morning. Okay. That is acknowledge them. Now I'm introducing myself. Myself, Deepa. I'm a nurse for the morning shift. Introduces. You done the introduction. Now you identify. The patient identification we already talked about in the previous sessions. So you can identify the patient by the name or UHID if it is an IP patient. So you are identifying the patient. Okay. So A and I is over. Now you are moving to the duration. Duration means how long you will be there with the patient. Okay, so duration matters much because patients are paying a good amount of money and they might be waiting for somebody or visitors or something, or they might be not fully in that mood to do some procedure or carry out or cooperate with the procedure. Okay, so what you have to do, you just tell the duration, not the exact duration. I'll finish it in 2 minutes. Okay, so you just say duration. Duration means the duration that is 5 to 10 minutes or 5 to 7 minutes. Like that, you can tell the duration. So, sir or ma'am, I am here for this particular procedure. It may take 5 to 10 minutes. Can you cooperate with me right now, or you want me to come after some time? See, duration is over. Okay, they will be also happy. Now, E. E means during the procedure or during whatever you are doing or whatever it is, explain the things. If it is not apt for the situation, educate the patient. If it is also not apt, engage the patient. Okay, so that is E. And finally, thank you for your cooperation. I'm moving back to my workplace. You can call me at any time by pressing the call bell. I'll be here. And till that, thank you so much. Like that, you can conclude the conversation so that see why we are using the communication tool, so that nothing will be missing in between. See, we are giving a proper, clear information to the patient. No, and the patient, the way you are communicating to the patient will be very happy also. Okay, so hope it is clear for you. Acknowledge, introduce and identify, duration, engage, explain or educate the patient, and finally thank the patient and can go back. Fine. So that is the edit tool, and this tool when the patient or the healthcare team member will use for their communication. So it's our responsibility to explain the things based on the edit tool. Okay. Now moving to the second tool, which is isbat. Okay, so first isbar is, first of all, I'll tell you when we are using it. Isbar tool is the communication tool in between the healthcare team members. Nurse is talking to a doctor, nurse is talking to a nurse, doctor is talking to a doctor, like that in between the healthcare team members. Whenever they are communicating about a patient, you see, healthcare team members are communicating in the hospital premises for about a patient only. We are not talking the casual things based on this bar tool, no. So for handing over, receiving the patient, telephonic communication in between the healthcare team members, you can use this ISBAR tool. So what is ISBAR? I means identify and introduce. Okay, so see, you need to identify your patient. You need to introduce yourself first. You need to identify to whom you are talking, and you both need to identify the patient upon whom you are talking. Okay, so that is the identify means, identify and introduce means three processes are there. First of all, myself Deepa, I am talking, am I talking to this person? So you identify the person to whom you are talking. Secondly, I am calling you regarding this particular patient. So you both are identifying your patient also. Clear? Now you are moving to the situation. What is the situation behind our conversation? Maybe a critical lab value escalation. No, usually critical lab value when you are escalating to the consultant, you can use this. You are telling an investigation report to a doctor, you can tell this. You are just conveying an emergency situation to your doctor, you can use this. So and so, sir, said this call. The situation behind this call is to inform the serum potassium level of the patient. It is 2 milliequivalent per deciliter. So that is the situation. No, you understood the situation, I hope. Now moving to B. B is background. Background means the history of the patient. Like this patient is admitted on this day with this complaint. Now these medications are going to the patient, like that, whatever the things. You should tell that to your person to whom you are talking about. And then say next thing is A. A is the assessment. Assessment means, like, for example, what all are the assessments you done on the patient? So the assessments means the vital signs and the sweating, patient is sweating or patient is having a tachycardia, whatever it is, your assessment. Okay. Then coming to R. R is the recommendation, or it can be a request also. So you can ask, sir, what you are recommending or what I have to do. Or you can even request, sir, I would like you to come and please meet the patient. Like that, you can even request also. So R can be recommendation or request. And finally, thanking and your ending your communication. So this is just I explained based on a telephonic communication. So if you're doing a handover, maybe shift handover or what to ICU handover, whatever it is. So you need to identify, introduce yourself, and you need to identify the person to whom you are giving the handover, and you both should identify your patient and the situation. This patient's level is this, it was the level and now it is, so the consultant told you to shift the patient to this, like that. Or background means the entire, if it is handover, you will check the patient file, patient's body, or patient surroundings, everything, and you will do the assessment, skin assessment, lines assessment, and all, and you the recommendations, what are the further proceedings of the treatment, like that you can end up the. So why we are using means, I already told you, we will not miss any information, or we will not proceed with the wrong information. So whenever you are using these things, it will be very, very clear and very, very accurate. Okay. Now, difficult customer. It's very common in all the scenarios, no? So difficult customer is there will be a blast, no? Code purple. Code purple is usually violence. We are announcing the code purple. So when we, two patients, or patient and we are also getting an argument, it will end up in a blast, no? So there is a tool to handle this kind of upset or difficult customer. So first of all, believe, BLAST is blast. So first B is believe. Believe what they are telling. Just think that, believe it. Maybe patient is telling, yesterday my bed sheet is not get changed. No, we know that, yeah, that you just changed, that you are arguing and just believe. Oh, sorry, sir. Just accept it. Now listen. L is listen. Listen what they're telling. Don't counter with them for each and every point. Just listen. Okay. Then apologize. Sorry, sir. I'm so sorry. I'm apologizing for the mistake. Then nobody will continue the fight further. If we are having a mind to apologize, nobody will continue the fight. No, of course. If then maybe just imagine one consultant is coming and shouting at me for a patient which is not assigned with me. Okay. So first, sir, I'm so sorry. So then you proceed with your things so that they will also listen. Okay. And they will say sorry to you later on. No. So you can just, sorry is a very, very magical word, which can cure so many of things, no? So many fights, so many things. Sorry. So people who are having a vast mind only can say sorry to others. Otherwise, our ego will not allow us to say sorry. Now, both of you mutually find a solution or try to satisfy others. Okay. And finally, thank. So that simple thing will make a blast situation to a very quiet situation. So what it is? Believe, listen, apologize, satisfy your solution, and thank. Okay. Now, the other one, which is read back, check back, and call out. Read back, usually we all know that critical value, receiving. Whatever we are writing or any verbal order usually nowadays we are not receiving, but still in any situation. So, or you are just receiving a critical lab value from the lab over phone. So you just write it and read it back. Okay. So many of the incidents happens in India or even outside. When you are going through the books, I'm not going to tell you the examples of all these incidents. So there are so many incidents happen, like whenever the critical value, just for example, one 11-year-old boy was there with, he was moderately mentally retarded. So this boy was staying with his mother. One day his mother went to market, and when she came back, she found so many paracetamol strips, no, like 15 medicine contained paracetamol strips found empty. Okay, so she just asked her son whether you consumed it. Son is very normal, no health issues, nothing was there. Like, as she went to the market, same condition was there with the boy when she back also. But still she has some confusion, as he is moderately mentally retarded. But usually he used to tell the things, but still she took the patient or the baby to the hospital. So the hospital, they took the blood and they checked out, and something they found. And after 10 minutes, report came from the lab as a call, and they told that it is 2.63 units. Okay, so 2.63 is a quite normal value of paracetamol. You know, more than 8 gram only causes it harmful, no, or like something alarming. Fine. So they told that it's not a alarming value or something. Maybe he might consume 1 or 2 tablet or not, whatever it is. So you can just take him back to the home, as he's not having any symptoms also. So the mother just took the baby back to the home, and after an hour they came with the boy as a broad dead. Broad dead means boy already died. So see why it happened. It was 26.3 or something like that. Just that point got changed. So what is the problem? The nurse who received the critical value, she didn't do read back. See, it lost life, no? So it's very, very important to do a read back, especially when you are receiving a critical value or you are writing some medicines or something. So you just write it down, then you just ask, excuse me, ma'am, let me repeat your thing. So it is 2.63 gram or 226.3, like whatever you are writing, read it back so that they will correct you if you are wrong. Okay, same thing, check back. Check back means anything like medicine or something. You are taking something, you just check it back with the origin or the source. Okay, so that also we will not land up in errors or mistake. And last one is call out. Call out is a simple thing which hardly we performs, you know. Like for example, one doctor is going for a rounds, and so many people like his PG students or nursing students or assigned nurse or 2 3 nurses, like a group of people will be there with him. So he is just telling, like just get the check, get the BP of this patient, go check done, let me know. So what I'll think, oh, she will check it, she will think the other person will check it. So ultimately nobody will check it, no. So for avoiding that, somebody immediately, that is a closed loop communication. If he is telling, please check the BP of that patient and let me know. Yes, sir, I'm going to check it. So that no remaining will be continue with their work, so that you can go and check it and tell. Another thing is code blue situation. See, code blue situation, team leader is telling one epinephrine, load one epinephrine. So usually what, usually the scenarios which I saw everywhere, 3 4 nurses will run for the epinephrine, and 2 3 people will take the syringe off. 2 people will open the epinephrine. So manpower is also wasting, material is also wasting, and time is also wasting. So instead of that, yes, I'm going to load epinephrine, so that remaining people will continue their work and you can peacefully do your work. So that is call out. Call out means just you take the call. Okay, hope that also clear for you. It will really work if you are doing it. And the telephone orders and all, especially you need to read back. So if you are interested, you can practice with your team members. Certain questions are there. And remember all these communication tools: edit, part, blast, read back, check back, and call out. It will really, really works. And the certain techniques which we discussed in the beginning. So start, speak up. Okay, don't be a silent nurse. Speak up where you want to. You are an advocate, patient advocate. You are a manager. You are an educator. So please speak up. Okay, speak up for your patient, speak up for yourself, and speak up for your professionals. Okay, and be a good ambassador. Communication skills make a man perfect, you know. That will, others will respect. If we are talking in a proper professional way, our patients will respect. No? So make that confidence in yourself, cultivate that. That will cultivate only with practice. So silence can kill. Speak up. Okay? So there is a quote for you. You can read that. So hope there is no questions. Any queries, any questions, you can contact me at any point of time. And so hope already you attended the pretest. Now there will be post-test for you. So please, now you might be much more confident to attend the post-test. And all the best. So bye-bye. See you in another presentation. Till that, bye-bye. Take care.